The holidays are all about sharing with family. Meals, couches, stories, Grandma's secret pecan pie recipe. And now you can also share a cart with Instacart family carts. Everyone can add what they want to one group cart from wherever they are. So you don't have to go from room to room to find out who wants cranberry sauce, or whether you should get mini marshmallows for the yams, or collecting votes for sugar cookies versus shortbread. Just share a cart, and then share the meals and the moments. Download the Instacart app and get delivery in as fast as 30 minutes. Plus, enjoy free delivery on your first 3 orders. Service fees and terms apply.
Hi, everybody. Sharyl Attkisson here. Welcome to another edition of Full Measure After Hours. Today, new insights on long COVID and COVID vaccine injuries. The government now says that most Americans are being impacted by long COVID, illnesses that continue to crop up sometimes days, weeks, months, or years after a COVID infection. But it's important to know something they are not advertising. This also includes long vax injuries, vaccine injuries that may occur long after vaccination, even if you had no adverse events at the time. From what I can tell, some public health officials are improperly trying to call all of them COVID-related without separating out the ones that are likely related to or exacerbated by vaccines. It's important for several reasons because the vaccine injuries, according to scientists that are treating these things, may need slightly different and sometimes more aggressive treatments than the long COVID injuries. And also it's important to fill in really major blanks that the government has left irresponsibly when it comes to this one-time experimental vaccine given to so many people. It has not launched an appropriate and effective campaign to monitor for and pick up adverse events, critical with any new medicine, but particularly an experimental vaccine, the likes of which nobody had ever received before, given to so many people. There should be very meticulous monitoring and required reporting for years, and it should have started the day the first vaccine was given. They pretended to have sort of a program that watched out for some immediate adverse events in a limited way. They very loosely collect them through the federal database without really making sure that most of the events are even reported by doctors in the proper way. But we really need to get better at figuring out what the vaccines are doing in the long term to people. We know not just the heart disorders that it can cause, but many other things being reported, such as vision problems, hearing problems, gut problems, muscle problems, paralysis, brain fog, you name it. The vaccines can be linked in some way because of the way vaccines work in our bodies to all kinds of problems in people depending on their other exposures, their genetic predispositions, and so on. But anyway, we're checking in today with a doctor who is looking at all of this, Dr. Jordan Vaughn, an independent doctor of Medhelp Clinics in Birmingham, Alabama. We did a very popular town hall with him over a year ago on these topics, and we've been checking in with him ever since because he is on the leading edge of figuring out the puzzles that may help us solve what could treat patients who have been told by the likes of Mayo Clinic that they can't figure out what's wrong with them. Well, Dr. Vaughn has been able to help some of these patients. He's treated thousands of them, and he's learning a lot. Today, he's going to give us his new insights on long COVID and COVID vaccine injuries and how he's treating them. And this includes emerging treatment of iliac vein compression by putting in stents. One reason you'll want to listen to this is because he's discovered a pretty big subset of his COVID and COVID vaccine injury patients have problems with compression of the iliac vein. This is sort of in the pelvic area. What's fascinating is this compression issue can manifest in all kinds of different ways with symptoms you would not connect to a compressed vein in your pelvis, let alone COVID or COVID vaccine. It can be rigid muscles, feeling very sick, brain fog. I mean, you name it, almost any kind of symptom you can have that could be impacted from ultimately, apparently from what Dr. Jordan says, your blood flow not working right or the oxygen not being transported properly through your body. That can be impacted. And the normal tests that you will go to get from a doctor who may say he's testing you for everything Dr. Vaughn says will not reveal this problem or other ones that he's been able to detect. So if you think you're reaching a dead end and you're having issues, don't give up. There are doctors who are looking into this sort of thing, different ways to test for it, successful ways to treat it, if not cure it, but at least to treat it and make patients better. I'll be reporting on all of this, by the way, on my December 8th program, Full Measure. But here now is the full interview with Dr. Vaughn. It's been a while since we checked in, and this is the type of thing where you're learning, I guess, day by day. What is the latest thinking and what's the latest that's new?
So actually, late August, a group at UCSF and the Gladstone Institute came out and actually confirmed, for the most part, what we had already thought, that fibrin was a big driver of a lot of this. And actually, the paper states that fibrin actually drives thromboinflammation. I think you've heard that word before when the last time we talked, and that it causes a lot of even the neuropathology, a lot of the brain fog, the cognitive dysfunction, those kind of things. The other thing that we're seeing is going back to the veins. Now, the first time we were here, we talked a lot about the small vessels, especially on the arterial side, the ability to get oxygen out to tissues. But not more importantly, just as importantly, is to get the sewage away. And so the veins and the venules have a lot of immunological function, but also the big veins are kind of your waste disposal center. And if there's any kind of impediment to getting venous blood back to the heart, it can cause a lot of these symptoms. And it seems like that COVID damages the endothelium, the inside of these vessels, and then makes them where most of these people probably already had veins that were a little bit more pliable and floppy than average, but it makes it even worse and causes them to have issues, especially young runners, even probably people we've talked to too, got better on anticoagulants, but then the additional thing we found is the venous component of that, and had to fix that as well.
How'd you fix that?
So medicines are helpful, and we're trying to come up with a lot of what I would call non-invasive ways to do it. We have some things that we're trying, especially kind of with the foundation, things that are like ultrasonic and also different modalities like EECP. But the current way to fix it is actually something called a stent. And so a stent meaning something that opens that vessel up. And my kind of partner in crime, I guess, in Colorado, we've done about 200 now in this patient base, anywhere from the ages of 15 to about 72, 73 is the oldest. And the young people definitely do very, very well. The older people, it does take a little longer because their veins are older to begin with. And so a lot of these people already had some kind of venous, spider veins or had ablations. And then, so they already had kind of stretchable or easy to damage veins. And now all of a sudden it's way worse than it was. So
try to explain just in the simplest of terms what the stent does, what's being caused, and then what the stent does for people. And we're talking about COVID and COVID vaccine?
Yeah, both. Yeah, without a doubt. And so the interesting thing will be that historically, this problem had usually been thought of as something that you're born with. And it is true that it does, people that have kind of iliac vein compressions, they're common within the general population, but they are not necessarily clinically significant. So a lot of these people go from having probably some types of lower extremity venous issues, things like they felt better when they ran, if they stood up for a long time or sat for a long time, their legs might go to sleep. Those are things that they had before COVID, but then all of a sudden they go from that to having basically not able to stand up for a long time, not able to run anymore, and it's just significantly affecting their life. So actually opening up that iliac vein allows that blood to get back to the heart, and at the same time drain your venous system. Your venous system's passive, it's low pressure, so it's really influenced by gravity. It's also the heart of your venous system is moving your legs. If you don't move your legs, which you don't usually do when you're asleep, a lot of these people wake up feeling awful, feeling like they haven't slept at all, feeling like it takes an hour for them to get going in the morning. And previously they were the exact opposite. People that got up at 5 a.m. and ran 4 miles, and they were the crazy friend. You said, can you just not run today? And they're like, no, I can't, I gotta run or I don't feel normal. Those kind of people. What does it tell you that this is a secondary thing you've learned? I think first of all, we knew some obvious things that were happening from people who had COVID and COVID vaccine problems.
but this seems to be a pretty big subset that was something you discovered later.
Yeah, and it really overlaps with, I think, more of a lot of the people are also what we call hypermobile or more flexible than average. A lot of them have GI dysmotility. They'll have lots of GI issues, and they'll be also super sensitive to every medicine. So they're kind of the last person you want to even try on medicine. So you got to be very, very careful. But it teaches you that there's a lot of overlap in how systems work, and you damage one system and then you cause issues with all kinds of other systems. And I think that's why it's so confusing to a lot of physicians, because it doesn't really follow the siloed medical world that we live in, where you have a cart issue and you need to go over there. You have a cancer issue, you need to go over there.
You're doing a lot of conferencing with other medical professionals, sharing what you've learned, kind of spreading the word. What is the status today of what the medical establishment thinks about all this versus what they knew maybe a year ago? Do you feel as though they're starting to get on board with understanding there's something different they may have to look at?
So I think there's two things that can happen. One is the medical system currently is trying to solve this issue through the lens of the top-down approach, which is gather all this information and then come up with a unique, one probably patentable solution. And the reality is these kind of disease processes, similar to the last time we talked of the kind of ME/CFS kind of cohort, they're not single issue or siloed kind of disease processes. So there's usually not going to be some monotherapy that actually proves to be useful. Instead, it's a lot of combining understandings of different systems and working with those systems to find ways with medicines that we already have. And so even not too long ago, went up to Washington to talk a little bit about this, but the main point is they actually were asking for help because they're kind of lost in it too. Again, it's not like some unique cancer diagnosis that they're allowed to get the genetics and the makeup and then, apply all the epidemiology and the phenotypes that come. Instead, it's almost like most of the people that are finding ways to help people are starting from the ground up. And a lot of times it's just asking the patient and figuring out. Sometimes a lot of my patients have tried stuff and it worked. And then when I think through it, I say, well, that makes a lot of sense. I might try that on somebody else. And that's really how medicine is more of an art to practice than it is something that's just easily prescribed and protocoled.
But that's really not the way I think a lot of doctors are taught to conduct their practices. So they're probably not doing that.
Yeah, I think curiosity has been beaten out of every doctor. And I'd say most doctors that really went to medical school after the onset of evidence-based medicine really don't know how to think about maybe some of the things that you're taught or some of the things that might help. And so they're kind of closed off boxes that are very good at performing procedures for things we know about. When it comes to something that we don't know about, we're really a pretty terrible system for doing anything about it.
Hey, Prime members! Have you heard? You can listen to your favorite podcasts ad-free? Good news! With Amazon Music, you have access to the largest catalog of ad-free top podcasts included with your Prime membership. To start listening, download the Amazon Music app for free or go to amazon.com/ad-free-podcast. That's amazon.com/ad-free-podcast to catch up on the latest episodes without the ads.
All right, let's be real. If you're a content creator, blogger, or an entrepreneur just getting started, the last thing you want to do is spend hours building a website. That's where Bluehost comes in. Their AI tools make custom WordPress sites in minutes. No coding, no stressing. You also get built-in marketing and e-commerce tools to grow your business. And with faster loading, you can secure the bag without the lag. It's never been easier to launch your website. Go to Bluehost.com now to get started.
What is your thinking today as to what is being caused by people who had COVID, maybe even without symptoms, versus what may be caused by people who had COVID vaccines and a problem with that?
So the vaccine, I think the more we learn about it, and again, learn about it as in they didn't know this either, which is even a bigger problem, that you kind of say that this thing from beforehand is safe and effective, and then the next thing you know, there's also complications to it. That seems to be the kind of the reverse way that we should be having any preventive therapy entered into society. But a lot of the vaccine injury has much more where it penetrates, so things like lots more neurological issues, stuff that's very disconcerting to the patient, but also mystifying to the neurologist. On top of that, it seems like immunologically, the vaccine makes your immune system in many ways different than it would be if you just had COVID. But I don't discount the fact that many of my patients have never had the vaccine and they have pretty severe long COVID symptoms. Just the same, I've got plenty of people that swear they've never had COVID and their immunological data proves that out, and they've got terrible similar symptoms as well. But the unique thing in that is the spike protein is the spike protein. And in a sense, that means that if we kind of understand the pathogen, then the pathogen being exposed to these people, it doesn't matter in some instances. It definitely seems to be worse with vaccine. And then there's other complications with the vaccine that we don't really, again, it's delivery technology, how well it's, where it spreads into different tissues. A lot of that is being discovered after the fact, which is kind of quite disconcerting.
There's a major study the federal government is behind. I think it's a global study called Recover. And I was surprised to learn as I was engaging with them that they don't seem to be separating out with their patient population who had the vaccine and who didn't.
Yeah.
Seems to me they're being presented with important data as we try to figure out, as we should be, what vaccine side effects there are. And yet they're blending, they're calling them all long COVID. They're not distinguishing between the patients who may have been exacerbated because they were vaccinated.
Yeah, and I think that the patients know. I will tell you that. Most of them can temporally tell you when things changed. But yeah, I think that's unfortunately on purpose. I will say in my clinic, the important thing is, have you been vaccinated? And then what were the symptoms after your vaccine? I would say some people never had any symptoms within that kind of 14-day issue, but then months later started to have interesting kind of cardiovascular problems or new onset brain fog, those kind of things. And it's, again, they haven't had COVID in that time period. But I like to make that distinction because it does kind of inform us, what kind of, I'd say the amount of damage seems to be more, the more times the spike has been allowed to run through your body.
Would it be important if the government is trying to figure out protocols and what's going on? Do you think it's important that they know this distinction between the patients who had vaccines and those who didn't when you're discussing a course of treatment, or is the treatment going to be the same regardless?
I definitely think it matters in terms of what kind of recommendations they blanketly give to everybody, like go get a repeat booster. I think last time I counted, the typical person, I think it's 10 vaccines or 10 total shots they should have had by now. Now, I will tell you, I haven't yet to meet probably one person that's had all 10, which makes me think there's a lot of anti-vaxxers out there because they didn't follow what the government told them to do. But in the end, the government is telling us to continually be exposed to this thing that we now know and all agree pretty much within the literature is a pathogen. And at the same time, they don't really know the long-term consequences, and their solution is to just give you another dose. And that, in medicine, especially preventive medicine, is absolutely contrary to the way we would design something to help prevent somebody from having issues.
Let's talk about the patients we're going to see today, or we already talked to. How is Hannah doing?
So Hannah's doing good. So she actually had a stent. And again, going back to that hypermobile, used to be a gymnast, Hannah's very much that way. And she basically is able to get along and do the things that she needs to do. And is she back running like Ellen? Probably she's really not, but she is 100% more functional than she was before. But there's still lots of stuff we have to learn. And I think that's the other thing is, especially when you throw in how many times she's had COVID and the vaccine exposure, she still has a lot of damage that needs to be repaired.
How many times has she had COVID and how many vaccines, if you know?
I don't know.
Okay, that's all right, go ahead.
But but in her, the vasculature itself has been damaged in a way that needs to be repaired. So even one of the things that my colleague in Denver we talk about, as well as my colleague at Emory, Alexis Cutchins, is, it's one thing to open up the vessel. It's another to understand that all the vessels are also probably having issues. They're just not as apparently obvious as the one that's compressed. And so we've got to make sure not only that we open it up and allow venous flow to happen, but we've got to heal the rest of the vasculature too. And there's lots of ways that we do that, whether it's with anticoagulants, other kind of supplements that help with the inside of the vessel to heal back to the normal state.
And how is Ellen doing?
She's doing good as well. She's
When we first met her, she was really not not doing well.
Yeah.
So she hadn't gone through the treatments yet.
Yeah, and she is actually doing really well. She's actually coaching, I think, a Sanford track team now, which has been fun for her. And she's not as much of a runner anymore because she's now through that part of her life.
Did she have a stent?
Yes, she did. So.
And what difference did it make?
A big difference. I mean, you could tell actually a lot of these runners have a lot of what we would call physiological data that they collect with these new devices like Whoops and those kind of things. And her heart rate variability instantly improved. Her baseline heart rate all the time. I mean, you could almost see it from when the stent went in, and she actually, because her dad is a track coach as well, so they like to keep up data on all of their athletes. You could just see it go, back to normal.
I still have hardly a day go by that I don't run into somebody who's having a problem that nobody can seem to solve, and they've been to the doctors and they wonder if it's something that if only they saw the right doctor, they might be able to figure out, because I think it might be COVID or COVID vaccine related. What is your advice to so many people who are looking for answers?
So first, I think it is to write down all your symptoms and write down things that you're experiencing. I think that really helps a lot of the doctors to put it all together, because especially when somebody comes with 6 months or a year of issues, and some of those issues change throughout time, it's really hard, especially in the way our medical system's set up, to sit there and digest that in 15 minutes. The other thing is coming up with a temporal relationship that either a vaccine or an infection had to your symptoms. And I think that's really helpful to doctors to go, you know what, you're right. You can't exclude that as an issue. And I think that also helps a lot. A lot of people haven't even thought about it. When I sit and talk to them about their symptoms and then relate it to when they had COVID or the vaccine, they go, no, I never really thought about that, but you're right. It was 1 week after that. And it's not that surprising to go, well, the likelihood that it's related to COVID is probably much higher if it has some temporal relationship to that. But that's not to say it all the time. It's also to find doctors that will listen, doctors who are reading a lot, and doctors who will try to care for their patients beyond the kind of protocols that most of them are probably, their heads have been hit with multiple times.
If you want more information and resources on this topic, I've compiled a resource list. If you go to SharylAttkisson.com, click the Health tab, and you will see long COVID and long vax resources with links to more information and also links to places where doctors are doing telemedicine evaluations for patients. They also have resource links to doctors you can search for in your area who might be read up on the latest science on this when maybe some other doctors are not. Again, the full story on this will be on the December 8th Full Measure show. To find out where you can watch, go to SharylAttkisson.com, click the Full Measure tab for a list of stations and times so you can find out when it's playing near you. If it's easier, you can always watch online at fullmeasure.news. We will air this episode on December 8th, live starting around 9:35 a.m. Eastern Time, and then it's posted thereafter. So if you happen to be listening to this after December 8th, never fear. You can go to fullmeasure.news and watch for free there anytime. I hope you enjoyed today's podcast, and you'll leave us a great review, and you will share the news with your friends. Check out my other podcast, the Sharyl Attkisson Podcast, and be sure to order a copy of Follow the Science, my new bestseller, How Big Pharma Misleads, Obscures, and Prevails. Very eye-opening. Read some of the 5-star reviews on Amazon to understand why this might be a valuable resource to you. That's Follow the Science. Do your own research, make up your own mind, think for yourself.